Hi, my name is Elizabeth Perez, and I will be conducting this conference call. This conference call is going to be in regards to the COVID-19 crisis. If you see me looking over at my screen, it's because I'm going over this information to make sure I have it all covered. So to begin, I'd like to just point out the elephant in the room, and that is the fact that the COVID-19 crisis has had us in quite the roller coaster. We have been suffering from a huge financial loss, and a loss of our staffing, loss of our supplies, loss of every single thing in each department. So regarding departments, we have lost not only employees, but we have lost a lot of valuable people who were working with the business for so long. And unfortunately, we also had to cut certain positions in all departments to help upkeep the others' pay, which something I'll go ahead and I will elaborate on later on during this call. So to start off, based on our recent analysis, finance reporting, and our recent analytics and data, it is shown that we have actually lost but also have gained. So to elaborate, at the start of the crisis, we lost several healthcare workers, and these healthcare workers have really fluctuated, I would say. Many of them, specifically to nursing staff, have expressed that they decided to go to other departments or other places that offered more incentive. And this is something that unfortunately we could not upkeep because of our financing. We had to cut back on certain incentives, we had to cut back on salaries. So some of them have expressed that they have actually moved on to contract work, and with that contract work, it's something that unfortunately we don't have and we cannot support. So we have had to take on the loss of certain employees within our hospital, but it's something that we are ongoing. We're always hiring. We've even relocated certain funds from one department to be able to locate those into sign-on bonuses, and that has actually helped us significantly. Another thing is with our certain departments, we realized that some of these departments had certain positions that weren't really benefiting us. We realized that we had too many medical transporters and ER techs, so we went ahead and we chose to cut off some of those roles, and there were layoffs, and unfortunately people did get laid off from those positions. However, it did help increase our financial status when it came to an overall analytic report. So that is something that we've been doing, is cutting supplies, cutting roles, and trying to allocate those sources into another source to help it bring it up. Unfortunately, unfortunately, because it's just so much, and we're a hospital, like each role is very important, we have had to take on additional debt, and this additional debt has actually, for our hospital, not has been significant than other hospitals. So I'd also just like to go ahead and add that in there, because we've been consistently working through this and we haven't taken a break from it. Our finance reports are doing a little bit better than other hospitals when they were released out to the public. So one thing that we have also done is we have hold our cash tightly by also cutting all miscellaneous needed supplies. So if our MRI machine, ultrasound machine, anything in radiology, or any type of tech item that needs to be updated, if it's not needed to be updated by state law requirement, then we have chosen to take a step back from updating that, and that has actually saved us more in our financing in that side as well, which is something I'd like to add because it was very significant. But we do still follow up with our machines and with our techs when it is needed and required. However, one thing that we have also been doing is managing several delays. So unfortunately there were delays with some insurances, but we have been able to just make contact with insurance companies, make contact with patients. Any debts that were owed, most of them have been cleared up. However, there is still a significant amount, and that is because the COVID-19 crisis really hit people also who weren't covered, and the hospital did have to take on that debt because we saw those patients, and now we're currently working on contacting patients and bringing in a flow of income, asking them if they can provide some kind of payment. We're willing to also help them get back on their feet by starting plans up, and are providing assistance in where they can reach out to help assist with any additional costs. So as far as government, Medicare, Medicaid, we have also been in contact with our government plans to really help allocate fees or allocate anything that we need for the patients who qualify for. So we've really been trying to get them involved more than they were before, consistently having a open line of communication, which has actually helped us in reducing certain costs before COVID, where we weren't so much in contact. It was more through certain departments that had that contact. There was a little bit more we saw of expenses coming through there, but ever since we decided to open up a longer line of communication with them, we have also seen a very big reduction in that. So as far as salaries, someone did want to mention the salary. So like I said earlier, like our salaries, some of them have been cut, some of them have been reduced, and it was even to the point where unfortunately we couldn't continue with certain employees. Based upon of law, we did offer the same salary that they were, but we could not offer more. So many of our staffing has fluctuated down and back up, but we are doing the best that we can to bring it back up by, like I said, providing certain sign-on bonuses and things like that to really help bring up our staffing. Currently we are staffed at 75%. It's actually better than our nearest hospitals are doing. We are actively hiring. We're actively finding people who have a passion for the field, more than anything. And that is all I have for today. Thank you.